So you've seen my face for 2 days in a row. My name is Marika. I'm one of the physios from treatmyachilles.com, and Alison is here, who is my colleague there, and she's going to do the whole session tonight. So I'll give it over to Ali tonight.
Oh, hi, like Marika said, I'm the other physio from Treat My Achilles, and this is the third of the 4 sessions of our Facebook Lives on the prevention and treatment of Achilles tendinopathy. And what we're going to be talking about over today and tomorrow is more of the prevention side, but also if you are suffering with an Achilles tendinopathy, how you might be able to manage some of your training to keep you training as much as you can. So we're going to talk today about what are training errors and why are they relevant to the Achilles tendinopathy, and then how can we adapt our training because of that, and looking at an acronym that's quite easy to remember, which is the VIP acronym, which we'll come on to in a bit, but it stands for volume, intensity, and plan. So what we're talking about, why is training errors important? Well, Marika spoke a lot about the treatment yesterday, and she spoke about 2 different types that were the best, most effective treatments for Achilles tendinopathy. One being the exercises to strengthen the collagen fibers in the tendon and the calf muscles, as well as other muscles that you might use when you're running. And the other being the load management part. So the load management being the activity that you're doing, which lends itself very nicely to training as one of those parts to the activities that we do in our day-to-day lives. So what we're looking at when we're looking at a patient with an Achilles tendinopathy is how to find this sweet spot of activity. So what does that mean? That means if you think about one extreme to the other, so the first extreme being a totally underloaded tendon, so somebody sat on the sofa not doing anything at all, and then the opposite extreme of somebody climbing a mountain carrying an elephant, which is a totally overloaded tendon. We're trying to find this sweet spot in the middle, and that sweet spot is the ability to be able to run and to continue to progress the running so you can meet your targets and your goals without flaring up any pain or activity. So what we typically find when we're looking at Achilles tendinopathy patients is they follow a pattern of not this sweet spot, but maybe more of a boom and bust cycle. And if you're looking at the evidence base as to training errors and things called overuse injuries, so overuse means no accident or incident involved in the injury, so an injury that's come on because you've used it. What that evidence is saying that up to 80% of those injuries can be caused by training error. So this boom and bust cycle is quite exciting, and this is where my first slide comes up.
Gotcha.
It's there. So you can see here it's the boom phase. It's where you're feeling great and you're keeping going and you're pushing your training and you're progressing on quite nicely. And this then gets to a point where you might have gone a bit too hard and too fast too quickly, and there's a bang and you drop back down to that bust phase where your injury is flared up and you can't train anymore. So what does this really mean for Achilles? If you imagine an analogy of a bruise on the back of your foot being the Achilles tendon, and if you were to press on that bruise on a regular basis, all of a sudden it gets a little bit sore. And when we first get an Achilles tendinopathy, you're more likely to feel it's a little bit of a background ache. It's maybe not something that's going to bother you too much, and it might even go off after a few minutes of doing activity or running. So you're sitting there thinking, well, I can still train through this. This isn't too bad. And you keep progressing your activity on and on and on. So it's a bit like pressing on that bruise multiple times. And as you press on that bruise, you wake up our body's alarm system, which is our pain system. And that alarm system rings lots of bells. It makes that bruise quite sensitive, and it gets more and more uncomfortable until we end up busting and not being able to run or do what we want to do anymore. And that's when we stop and we rest. And as we rest, that alarm system hasn't got that bruise being pressed on, so it starts to calm down. It gets less and less and less sensitive until you can't feel it anymore. And you think, oh, great, this is all fixed now. Everything's fine, and I'll go back training again. And you start to go back training, and all we're doing is pressing back on that bruise because the rest hasn't changed what's going on in that tendon. It hasn't treated that tendinopathy. All it's done is calm down our alarm. So we go back training again, and you build up, and it might not be the first run, it might be a few runs later, you start feeling those symptoms again. So this is the exact opposite, as you can see, from that sweet spot. So how do you know if this is you? Well, one, you might recognise it because it's something that you are aware of when I've been describing it. And two, if you were to look back over your data of your runs, so you could use wearable technology for this, you could use apps that might have logged your runs, you might just be able to look through your diaries and work out what you've been doing. And if you see a general trend of quite a lot of activity and then not very much activity, it may relate to your pains and your symptoms, so you're aware you're suffering this boom and bust cycle. Another thing to think about is this might not be just how much you're running, this might be how fast you're running, it might be how many hills you're running and what you're doing from an elevation perspective. So it might not be just mileage you need to look at, it might be all of the other different factors that send you off into this boom and this bust. And a side note here, it's important to notice that when you're getting this pain, it is just an alarm system and it doesn't relate to any pathology or how serious the nature of your Achilles tendon problem is. So you can have the world's worst amount of pain, but if you would then look at your Achilles tendon under a microscope, you might not see many changes at all, and vice versa. So pain is literally an alarm system. It doesn't correlate to what's going on inside that tendon at all. So it's with the respect to pain that we're trying to find this sweet spot. And then so how can we do that? Well, some of the quick ways to look at that is using this VIP analogy. So if we call up that VIP slide.
Gotcha.
Yeah, so you can see it's quite simple. It stands for volume, intensity, and our plan or the program we're running to create that plan. So we're going to first start about volume. And volume means how many miles that you're actually running or kilometres that you're actually running and how many times that you might be running in that week. So if you were to look at a week-by-week training schedule and add up how many miles you run throughout as many runs that you do and get a total number of mileage, and then look at that over the last few weeks that you've been running, what you're planning this week and over the next few weeks what you're planning, can you see the difference between those totals? And what we're trying to find out with the research is what is the best percentage change in those totals that we want to do to progress our running on. And that's a little bit unknown, but what we do know is the opposite. We know what's a detrimental amount of change, and that can lead to injuries and pain. So that detrimental amount is if it's lumped up about 30% in any one week. Now that doesn't matter how fit or healthy you are or what you're used to running, it's relevant to you. It's 30% more than what you did last week compared to this week. And that is the most likely to wake your alarm system up and cause pains and injuries, or actually cause an overuse injury in the first context. So what we're looking at is what could we do if you've noticed that you've got a 30% change? Well, the ideal, like we said, is unknown, but the general rule of thumb is around about a 10% increase. And that 10% increase is something that you probably have read about if you're a keen runner and done it for a while, because it tends to be what most running programs you find on the internet or in running magazines follow. So that 10% increase is what you're roughly looking at each week. But then there's been a bit of debate about this. And is this something we should be looking at carte blanche? Is this something we do if we're a 5K runner or if we're an ultra marathon runner? And actually the debate is maybe it's not so relevant for absolutely everybody. If you were a lower mileage runner, so somebody that runs 5 to 10K a week, you're probably thinking maybe half a K to 1K increase per week is quite easily done and I could manage that. So you're potentially looking that you could increase by 25% each week and be probably okay. Your second group, if you're a moderate runner, so if you're running sort of 10 to 20K a week, you're in that middle section, maybe that might be about a 20% increase. And then if you're in the 20 kilometres or more a week group, then you stick with your 10% increase. So it could be relevant to what you're doing. And again, this might be different for different people, but as a rough guide for our volume, we want to be looking at no more than a 30% increase. And depending on how much you're doing, rough guide is about 10% each time. So that's what we're doing on a week by week basis. So now we need to look a little bit more at the medium term. So by that medium term, I'm talking about like over a month period. And if we then go to the strength and conditioning literature that's out there, they tend to do a program where you would up your weights for 3 weeks and on the 4th week have a lower weight or a consolidation week. And this allows time for your body to adapt to that training stimulus. What does that mean? It allows your body to have time to get stronger, to lift heavier weights. And the evidence base has shown that's been better with the performance angle after you've done 3 weeks of heavy increasing and 1 week of dropping. So that's been very relevant to running as well. And it's been shown to help increase performance. So if you want to run better and you want to hit your targets better, it might be worth doing a 10% or so increase for 3 weeks, and on your 4th week have a consolidation week or drop it back down a bit. So there's some considerations, and it might be worth having a look at your program and what you're planning to do and seeing whether you can alter that. And we'll talk a little bit more about that 3 weeks on, 1 week consolidation tomorrow when we cover the rest and recovery side to a training error and how best we might be doing that. So in a nutshell, that's our volume. So we've got a quick summary of that comes up.
Gotcha.
So in summary, no more than a 30% increase per week. Rule of thumb is 10%, but there's some fluctuation in that. And every 4th week, you have a lower mileage week. So that's the V part of our VIP. And we move now on to the intensity part. So if you remember our boom and bust cycle, that bit said too hard and too fast. The intensity part is it talking about too fast, the bit where you're how hard you're working, how intense are you working. And this can be something that you could have a look at in regards to measuring this by thinking about an 80% low intensity split to a 20% high intensity split. And going back to what Marika was saying yesterday about load, we're not just talking about your load here with training, we're talking about your load here with all the other things you like to do. So do you walk your children to school or walk your dog? Do you do HIIT classes or yoga classes? And do they classify in the low intensity or high intensity or manual working versus sedentary working? And you're looking at trying to add this all up, and you could do this in minutes if you wanted to do it formally, or as a rough guide in your head, are you doing this 80% to 20% split? Well, that's absolutely fine and easy to say, but actually what is low intensity and what is high intensity, and how do we know if we're working at those levels? Well, there's a couple of easy ways that you can measure this at home. One, again, relates to that wearable technology that you might have, and that might be monitoring something like your heart rate on a very regular basis. And some of those wearable technologies give you the ability to look at your watch and see whether you've got a green, amber, or a red level of heart rate, depending on what you're running and what you're doing. You also might be able to look back in retrospect and have a look at your heart rate, and they might give you guidance as to what brackets you should be doing. If you may have a chest strap, and that's shown to be a little bit more reliable in the research than the wearable technology, but this is here as our rough guide of our 80-20 split. We're not doing science experiments, so it's there that's a rough guide is useful. The heart rate is one option of measuring it, and if you're not sure what you should be working at, there are free calculators online, and one of them is called the Macmillan calculator. And if you were to go on there and put in your demographics, your age and your weight and so on, and then what your target training is, so are you trying to run X number of minute miles or a half marathon in under 1 hour 45, you put in what your target is, and it comes out with how many minute miles you should be running and what roughly your heart rate should be around that time too. So that can give you a guidance on this intensity front. Now, if you're not interested in that, or you haven't got access to all of this technology, a really simple way of doing this is to use a scale called the rate of perceived exertion, which again comes onto this other slide. Now, that sounds super fancy, but really it's giving myself a score out of 10 as to how hard I'm working, and it's no more fancy than that. If you have a look on here, we go through the different categories. You've got your 1, 2, and 3 out of 10, which is your light activity, or I can talk through the whole time of this and it's not too much bother. And this is your low intensity section. This is your 80% of runs. So by 80% of runs, that would normally be your longer run in the week or couple of runs. If you then move into that middle part, that 4, 5, 6, 7 out of 10, this is where I can hold a conversation, but probably just a sentence or so at a time. I'm working quite hard here. And this is 12% of your runs. So tempo run, for example, would fit into this bracket. And the final level being 8, 9, and 10. So I'm working so hard, I can probably get a word out or not at all. It's really maximal effort. And this is showing that this could be about 8% of your runs, which is normally your hill reps or your speed work. So if you're having a look at your diary and your program of what you're doing, and you can give yourself a score out of 10 or retrospectively think about the scores that you would give it, again, that can give you a mark to see whether you've got your split right in your training program. On a side note here, if you think about what an Achilles tendon does, when you land with your foot to the floor, what it does is recoil and store energy. And as you go to push forward to move on to the next step, it releases its elastic energy and it makes that propulsive movement possible. So this tends to be more on the front of your foot or forefoot, so around those toes area. So if we are looking at your program, for example, if we're looking at you from a Treat My Achilles perspective and we want to keep you running, if you already have an Achilles tendinopathy, the very hard activities, the hills reps, the sprints, the stuff on your toes might be the first thing that we edit slightly to keep you running and keep you moving. So our summary for our intensity section shows that we're looking for this 80-20 split of low and high intensity for all activity, not just running. And can you measure that roughly or have a bit of a thought through about whether you're doing that? And you can use your heart rate or the rate of perceived exertion if you wanted a easier and better way of measuring that. So we're on our P part of our VIP now, which is our plan or our program. And this is relatively quick, this part of it, because it's basically asking yourself a few questions about why you are running and does what you're training for match why you are running. So are you running to do a couched 5K and you're a novice runner? Are you running to help with mental health and coping strategies? Are you a runner to try and do an event that you've never done before, a distance you've never done before, or to beat your time on an event you've done? And does your training respond to that? So, for example, are you training every day? And quite a lot of people in the running community tend to think that every time they go out, they've got to run really hard and their maximum capacity. Well, we've already proven that in the intensity section, that this 80-20 split is the best way to perform and increase and not get injured. So if you're running every day, you need to be asking yourself, do I need to do this? Do I need to do this? Is it going to help my performance? And that's something about how we would add in rest and recovery, which we will cover a little bit more tomorrow. Also, are you running and doing a lot of speed work, but yet you're trying to work for mileage? Does that make sense to you? And can you cut any of that out? Are you training with other people that are dictating how much you're running, or whether they've got different goals to you, or running clubs that are telling you when to run? And please don't compare yourself to Joe Bloggs down the road that can run for absolute ages and doesn't appear to have any niggles whatsoever, because we've noticed with the research that there is such a wide range of variability of normal for what people can stand and what people can manage. And we also have to think that we're multifactorial. We all have different ages and genders and general health and medications and what we like to do and how fit or how strong we are. So we cannot compare like to like. So my final thought for you is have a look at what you're running and how often you're running. And are you running to hit your targets, or are you running just out of habit? And it's worth having a discussion with yourself or a coach or a friend to see whether you can change that. So our summary in total for today is, have you noticed any training areas from what we've been talking about? Have you found yourself following that boom and bust pattern? Are you training in your sweet spot already and you want to prevent injuries? How best you might do that, and look at that with the VIP acronym. So your volume, less than 30% increase per week. Can you have a fourth week where you decrease? Your intensity at 80-20, and your plan, does that match what you are planning to do? So if you would like to find out any more information, we've got a blog page on our website, which is on the top, I think, of this stream that you can click on, and you're very welcome to contact us with any questions or to indeed book an appointment, and it goes through how to do that on there. I just wondered, do we have any questions?
Not at the moment, but I was just thinking as you spoke, if they wanted to see this information in front of them, because sometimes you think, oh, it's really cool info, but you forget it quite quickly. You've written blog posts about each one of these categories before, haven't you?
Yes, yeah. So I think there's a boom and bust one. There is a rest and recovery one. There's a too intense mileage, And I think there's a volume 1 as well. So I think there's 4 in that series.
Yeah, exactly. So like Ali said, if you go onto our blog, I've forgotten to put the link in the description of this video, so I shall be putting it in there quite soon. And if you go to our blog, you'll find loads of articles, little snapshots of everything that we speak of that we've done previously as blog posts. Okay, guys, so if you're watching this on replay, I haven't got any questions at the moment for us to answer, but if you're watching this on replay and you've got any questions, please feel free to ask them. If you tag Ali or myself or the Treat My Achilles page, we'll be more likely to see it as well. So, but you're always welcome to also just message us if you want. Then I think that's it from us. So
Brilliant.
I'm going to say goodbye from my side.
Yeah, and bye from me too.